This video presents an overview of the Chronic Overlapping Pain Conditions Screener and an example of its use. The COPCS is an efficient, logic-driven method of screening for the presence of multiple chronic overlapping pain conditions within a given individual. The criteria for each condition is either the published diagnostic criteria or modified criteria that has been derived from a consensus panel composed of authors of the published criteria and content experts. The conditions assessed by this screener include the following: fibromyalgia, chronic low back pain, temporomandibular disorder, irritable bowel syndrome, myalgic encephalomyelitis or chronic fatigue syndrome, urologic chronic pelvic pain syndrome, migraine, chronic tension type headache, painful endometriosis, and vulvodynia. The screener uses a body map to trigger the assessment criteria associated with COPCs at each body region. So as to limit responder burden, business logic terminates subsequent questions once it is determined that the individual will not meet criteria for a given condition. Once a respondent has completed all questions, a report is generated that identifies each COPC for which criteria are met. The number of concurrent COPCs within the individual is also displayed. Here we will provide a demonstration of an individual completing the COPCS.
Today I will be completing the module as a patient with fibromyalgia, migraine, chronic low back pain, urologic chronic pelvic pain syndrome, and irritable bowel syndrome.
This is the Chronic Overlapping Pain Conditions Screener, and I'm going to give you an example of how to use it and the resulting information. So after a brief introductory screen, we're taken to a short demographics section. After completing the demographics, the first item is to select pain that has occurred over the last 30 days in any of the sites that are displayed. So I'm going to go ahead and indicate that I have abdominal and pelvic pain, in addition to lower leg and upper body pain, pain in the lower back, and pain in the head. As a result of selecting these areas, I am going to be offered several additional modules that will determine whether or not I meet the criteria for various COPCs. So first, it's going to ask me some additional questions about symptoms. Do I experience persistent fatigue? I'm going to say no. I'm going to say no to these additional items, except for this one about sensitivity to bright lights. Okay. Some additional questions about symptoms. I'm going to indicate significant issues with fatigue, cognition, and sleep, as well as pain in the abdomen, depression, and headache. I'm going to indicate that these symptoms have been present for at least 3 months. Okay, I selected on the body map the head. However, as this test patient, I'm not going to indicate that I have temporomandibular disorder. Instead, I'm going to say that I have migraine. So for this module, which asks, on average, how long did the pain last in your jaw or temple area, I'm going to say I have no pain. As you can see, that essentially ends the module. Okay, how about low back pain? How long has low back pain been an ongoing problem for me? I'm going to indicate that I've had low back pain for 1 to 5 years. And I'm going to say that at least half the days in the past 6 months, I've experienced that pain. I'm going to say no to this question about burning sensations or tingling or prickling sensations, as well as this question about electric shocks or burning. Have you ever had a feeling of pain, pressure, discomfort in your lower abdomen or pelvic area that has been an ongoing problem for you? I'm going to answer yes to this question because we're trying to reach a diagnosis of urologic chronic pelvic pain syndrome. How long has that feeling lasted? I'm going to indicate 6 to 11 months. In the last 30 days, have you had pain or pressure in these areas? I'm going to indicate yes. And in the past week, I'm going to indicate that I have, in fact, experienced pain during urination and pain with other activities associated with UCPPS. Okay, that's the UCPPS module. This is the module for questions about migraine and chronic tension type headache. So the first question they're going to ask is, in the last 3 months, how many days did you have a headache of any type? I'm going to indicate 45 days, or half. And in the last 30 days, I'm going to say that I also experienced headache on half of the days. Okay, additional symptoms experienced during the headache. Sensitive to light. I'm going to say yes. I'm also going to indicate that I felt more comfortable in a quiet place during the headache, and that the headache was often moderate or severe. These are questions about medication use. I'm going to indicate that I have been using over-the-counter medications roughly on half of the days, but that I am not using prescription medications. This is a question about abdominal pain. I'm going to indicate that 2 to 3 days a week, I experience pain in the abdomen. And I'm going to indicate that this occurs in conjunction with bowel movements roughly 60% of the time. We've now reached the end of the modules. This indicates that I would meet the criteria for 5 different COPC diagnoses, including fibromyalgia, chronic low back pain, urologic chronic pelvic pain syndrome, migraine, and irritable bowel. And that completes the COPCS.